job. At this time, because all our women contestants. So say thank you for coming to the homecoming celebration here in Winnebago, Nebraska. And it's your style, lady. Good job. Thank you.
Oh yeah, you're looking good, dancers. Sounding good. Here you make me like it. Yeah, make me like it.
You're now listening to High Noon all the way from Ottawa, Alberta, Canada. Welcome, gentlemen. Good job. Omaha Lodge, get your song ready. Coming into the arena at this time is a woman selling cloth and buckskin. Good job. Thank you, thank you. Omaha Lodge, you're on the air. Take it away, boys. Good job. Coming into the arena at this time is our women's gender dancer. Good job. Thank you to each one of you for coming over to our celebration once again.
Oh yeah, good song here. You're making them dance, you're making them like it. Omaha Lodge. Coming into the arena at this time, women's traditional. Welcome, ladies, welcome. Thank you for coming to our celebration. And we're right behind them there into the arena, women's fancy. Fancy Shaw. Dance your style, ladies, dance your style. Looking good, dancers, looking good. What shimmy there, what shimmy there. Good job. Good job. Oh, big good job. Oh, big good job.
Southern Tune, the song ready? Our team categories are coming into the arena at this time. Good job. Team boy traditional, and your style, boys. Good job. Way to go. Good job.
Coming into the arena at this time, Team Boys Grass. Team Boys Grass.
Good job. Moose Hill, take it away. You're on the air.
Good afternoon, everybody. Thursday, May 7th. This is the weekly Winnebago COVID-19 weekly update. And today is the National Day of Prayer. And we consulted with Chairman Brown, and he had asked Mr. Mayan Beltran to render today's prayer. Mayan.
Good afternoon, everybody. Lord, I would like to say some prayers for our Winnebago tribe of Nebraska community, family, and friends. Our Winnebago task force, pandemic task force, working hard, trying to make good decisions for our people. I'd like to say a good prayer for our Winnebago Tribal Council to make the right decisions for our people. I'd like to say a good word for our military, active, our veterans. Please keep them safe. Bring them home safe to their families that think about them, that worry about them. Taking care of and fighting for our people and our country. I'd like to say an extra special prayer for our hospitals, our emergency staff, our frontline workers. They're working hard during this pandemic, dealing with a very ugly sickness that affects a lot of families, a lot of friends, and they're risking their lives to do that. So please take care of them for me. I'd like to say a prayer for the families out there that are dealing with it, that have been tested positive, for their families and friends that are thinking of them. All the people, the Winnebago tribe, community, all the people around, all the elders, all the children, they're the future. I'd like to say a prayer for them. I'd like to say a prayer for all the teams, the subcommittees that are working hard on the behalf of the Winnebago tribe and the pandemic task force, recommending decisions that will be made at a higher level for our people. If I left anybody out, Lord, please take care of that for me. Amen.
Thank you, Mayan. Appreciate the prayers. At this time, we'll have the opening statement by our chairman, Mr. Coley Brown.
Thank you for that prayer, Mayan. Thank you very much. That's the best we got. It's going to take us a long ways. We're at week 9 of our COVID-19 update. It's been a road. It's getting a little bumpy now. And I want to thank everybody. Thank everybody for the work you've done, the commitment to try and keep this community safe, try and keep yourself safe, and working for this tribe. Thank you very much. We got a ways to go yet. We'll get through it together. Just a little more time. All the hard work that goes out. I want to say congratulations to our graduates of the Winnebago Public School as they go through this with us. And I know Dan Farringer will touch on that for us. So I'm very thankful today for all that's been done and how we are and where we're at. So again, thank you all very much. And I will turn this over to Mona Zavante. Thank you.
I think Danelle Smith, our Winnebago Comprehensive Healthcare System CEO, has a few words to say.
Okay, Danelle?
There.
There you
Now,
go.
can you hear me?
Yeah, we can hear you now. Thank you.
Okay, thank you. Good afternoon, everybody. My name is Danelle Smith, and I'm the CEO for the Winnebago Comprehensive Healthcare System. WCHS is the umbrella organization for the 12 Clans Unity Hospital and the Winnebago Public Health Department. And I'd like to share with everyone that our team at WCHS throughout both the hospital and the health department have been working very hard, as you all can see, to prepare for and to respond to the COVID-19 situation. And I really appreciate everyone's effort to take care of everything that's needed for our community, especially our frontline staff who have to interact and care for patients every day throughout their work. I'd also like to acknowledge that April 6th to the 12th of 2020 was National Public Health Week. Nurses Week is started yesterday, and that starts on May 6th through May 12th. And National Hospital Week is May 10th to the 16th. And while we know that the hard work is carried out every day throughout the year, these dates are set aside in our country as a time to recognize the contributions and hard work of our public health personnel, our nurses, and our hospitals. Healthcare workers have a very special responsibility to our patients and our community, especially during times like this when we have a pandemic that is affecting all of our lives, not only in our community of Winnebago, but throughout the country and throughout the world. I have also had the opportunity to participate in the Winnebago Tribe's Pandemic Task Force. And I would have to say that not only the coordination between the staff at the hospital and the health department has been extremely, it's been tremendous throughout this whole time. Everybody's really come together to work very hard, ideas put forth, plans put into place, and it's really made a huge impact on our ability to do the job that we have to do. But through the Tribe's Pandemic Task Force, that same effort is being demonstrated throughout our entire community of Winnebago. And the coordination and the cooperation, the relationships that are being built between all of the Tribe's organizations has really been just exceptional. And I'm happy to have the opportunity to participate in that. And I think that it's going to benefit us not only during this time, it is benefiting us, but it's going to have a major impact on our community as we move forward and as we work every day to make a better life for Winnebago. Each and every one of us has had to adapt our lives, both at work and in our personal lives. It has affected how we work, how we learn, and how we interact with each other. I think we should view this, try to look at the positive side of things as we go through this. I know that it's very stressful, but there's a lot of resources out there to help. And I would encourage everybody to, connect with your family members, connect with your elders, connect with those resources that we do have available in our community to help us get through this time. We as a tribe and as a community, I believe, must remain steadfast and do whatever that we can to help take care of each other and know that together we will get through this challenging time. And so I really look forward to continuing all of the hard work that we've been doing and looking forward to getting back to a normal life. At this time, I will go ahead and turn it over to my team to go through the slides that we've prepared for you today. Our slide presentation has been shortened a little bit this time, just to kind of condense and focus the information that we know that the community needs to have. Thank you.
Okay, thanks Mayan for the prayer, the good words from Coley, and thank you, Danelle. I wanted to start off by saying Happy Nurses Week. I want to specifically thank the Winnebago Public Health Department nurses that are manning the hotline, doing all the case investigation and following up on the close contacts and the positives that live in Winnebago, but also in the surrounding areas. I'm so fortunate to be able to work with such amazing and dedicated people. I came across the nursing staff oath of services, and I wanted just to share that with all of you today. The nursing oath is to cooperate faithfully with the other members of the nursing team and to carry out faithfully and to the best of their ability the instructions of the physician or the nurse who may be assigned to supervise their work. They will not do anything evil or malicious and will not knowingly give any harmful drug or assistance in malpractice. They will not reveal any confidential information that may come to my knowledge in their course of their work, and they pledge themselves to do all in their power to raise the standards and prestigious of the practical of nursing. And I believe that is what our nurses do every single day. So I thank them for all of their work. I know it's a very stressful time throughout the whole United States, but I want to really commend them for everything that they're doing. So as I'm not sure if the press release went out already, but we do have 4 confirmed positive cases in Winnebago. We have several others outside of Winnebago, and Angie will touch on those today that we are following up on. Most of the positive cases, along with their close contacts, have been able to recover and come out of quarantine, depending on their symptoms and the testing or the last contact. We continue to be very proactive. We place all of those that have come into close contact with a positive within a certain window into quarantine. We are all in this together. We are all working towards a common goal. And I have heard a lot of great comments about how we've responded as a Winnebago community and being so proactive at interacting with the public, taking measures to stop the spread as much as we are able to. I am so proud of this team and everything that each of us are doing in order to flatten the curve. I know we're very apprehensive that the surrounding communities are starting to lessen their restrictions, even though the rise in positive cases and death increase in certain areas. Therefore, we here in Winnebago must continue to be vigilant, be watchful of everything going on around us. We don't want to loosen our restrictions too soon. We don't want it to be devastating to our people. So we will continue to be mindful and watchful. Again, thank you to all the staff that are working through this stressful time and all of those behind the scenes. All of us continue to be at risk for COVID-19 infection. So please stay home, stay healthy, and stay connected. And now Angie Keller with our public health nursing will start this week's presentation.
Good afternoon, everybody, and I just want to thank you for taking part and taking the time to listen to the community update. So this is all the information we have as of May 7th, so today. The current statistics for the National and Nebraska and Winnebago areas are that there is currently 3,906,678 cases in the United States. Total negative cases in the United States is 2,712,865. There's a total positive of 1,193,813. And there has been 70,802 deaths in the United States. For the state of Nebraska, there is have been a total of 37,829 total tests completed. Of those tests, there has been 30,987 that are negative, leaving a total of 6,771 positive tests. There's been 86 deaths in the state of Nebraska. For Winnebago, there's been a total of 26 tests completed. Of those tests, 18 have been negative. There are 4 positives for positive COVID cases here in the Winnebago community, and there's been no deaths. There's currently 4 tests pending, so we're waiting for results on those for individuals within the Winnebago community. For non-Winnebago community, so that's people that live outside the Winnebago, it's 39 have been tested totally. Of those, 16 are negative. There are 8 that are positive. There has been no deaths associated with the tests that we've done. And then there is 15 currently pending. So I just wanted to touch a little bit more on the exposure and kind of the contact tracing cases that we do and how that works here with anybody that's tested here within Winnebago. So your risk of exposure, your highest risk of exposure are those who live in the same household or have had close contact. So that is a contact with an individual that is less than 6 feet away and it for a greater time frame greater than 10 minutes. So this diagram here kind of illustrates how a close contact investigation would happen. The individual in the middle that has the white circle around her, she is the confirmed positive case. So you can see the individuals in the blue circle are then those that she's had close contact with or that reside in the same household as her. So those guys are identified as a high risk exposure group, and those individuals are advised to self-quarantine. We are trying to be a little bit more proactive, and if an individual is advised to self-quarantine, we are asking that their household self-quarantine as well, and that's just to hopefully be a little bit more proactive and decrease the risk of exposure in the community. The individuals that are in the black circle, in between the blue and the black circle, those are kind of contacts of the close contact. So those guys are at low risk. They are not yet associated with a close contact with a positive individual. It's more of a lineal linkage that we are focusing just on that first link. So they are considered low risk because they might have had social interaction with or a short duration with a confirmed case or a close contact of a confirmed case, but are not experiencing any symptoms, and there's no need for them to self-quarantine. With those individuals, you do need to make sure that you are still practicing social distancing and taking the precautions needed to prevent the exposure, to prevent the risk of your exposure, and to limit any risk of infection. And then the COVID hotline is available is manned by the PHNs here and a couple other nurses in the Winnebago Public Health Department. So the hours of operation for that is 8 a.m. to 8 p.m. 7 days a week. If there is anything that's needed after 8 p.m., we do ask that if it's non-emergent, that you can either leave a voicemail or send a text message, and we will return your call the next day as soon as the operating hours start. And if it is in the event that emergency is needed, you do need to contact the ER or emergency services. Whenever you call the hotline, you'll always be asked this information. We'll ask your name, your location of residence, the reason you're calling, and then if it is related to any symptoms relating to COVID, what those symptoms are. That just gives us a basis of what we need to do for you and the services that we will be providing. Next is Laura's going to talk about the changes in the testing procedures that have been taking place at the hospital.
Hey, Laura, can we get you unmuted?
Yep, thank you.
Yeah, no problem.
Hello, everybody. Good afternoon. Just wanted to go over some of the testing processes or prioritization with you. We've been doing this about every week, and I think it's good for everybody to know. But, to learn if you have a current infection, viral tests are currently used, but not everybody needs this test. Most people will have mild illness and can recover at home in self-isolation without medical care and may not need to be tested. And I get my information right off the CDC website. So this can all be seen on that website too. So here's what they have for priorities for COVID-19 testing. And this is what we've been using ourselves. There are high priority people that need to be tested, and those are hospitalized patients, many times with symptoms. Sometimes they'll test them if they don't have symptoms. Depends on the hospital. Healthcare facility workers, workers in congregate living settings and first responders with symptoms, residents in long-term care facilities or other congregate living settings, including prisons and shelters, those with symptoms. Priority, these aren't quite as high, but they are a priority. But persons with symptoms of potential COVID-19 infection, including the fever, the cough, the shortness of breath, the chills, the muscle pain, new loss of taste or smell, vomiting or diarrhea, and or a sore throat. So those have increased since we first started this presentation. There are more symptoms now. And persons with symptoms who are prioritized by health departments or clinicians, such as right now, those that work in maybe a meatpacking facility, public health has asked that those people be tested, maybe more so in group testing. And then we're also looking at maybe a clinician wants somebody tested for some reason because they clinically think they need to be tested. We are doing sentinel surveillance, and then we're looking at screening asymptomatic individuals according to state and local plans. If COVID-19 testing is warranted, meaning the criteria is met, then a test may be sent to an outside lab. Current turnaround time for those tests right now for us is about 1 to 2 days, which is pretty good. Now that could always change if more tests are being sent into these labs. There are tests available for rapid COVID testing on site depending on the symptoms that are present or the type of exposure. We have been working on ways to collect specimens so that we are limiting exposure to the staff and other patients. And then processes have been in place to ensure that the Winnebago Public Health Department and 12 Clans Unity Hospital are communicating test results and follow-up. This has been working very well. We just wanted to let you know that the telehealth visits will start May 11th. Telehealth appointments are not available for every type of visit though. Patients will need to confirm with the hospital staff if their visit qualifies for a telehealth appointment. The hospital will work with all eligible telehealth patients, regardless of access to technology or internet availability, to provide telehealth capabilities. And you can call 402-878-3404. And just understand, this is our first, we're just getting started with this. We're very excited to get this going. So bear with us and we'll work with you as best as we can. So on behalf of our entire team, we really want to thank everybody. You guys have been, the whole community's been great. And I want to thank all the nurses for Nurses Day, Hospital Week. Next week, we've got some fun things planned, and just everybody that has put so much work into all of this.
Thank you, Laura. At this time, I believe Emily, let's see here, we had remarks from Danelle, Laura, Mona, and Angie. Is this the portion that we go to the CEO of the Winnebago tribe? Okay, Esther, are you there? Esther, oh, okay.
Hello, can you hear me?
Yep, we can hear you.
Okay, thank you. Well, I'd like to start off by telling everybody good afternoon to everybody, and thank you for joining us today. I'm pleased to report today that the tribe has received its initial disbursement of funding through the CARES Act. The tribe has been working in conjunction with the Pandemic Task Force to identify community needs, which will be addressed through the use of these funds. The tribe will be working over the next week to finalize the budget in order to present to the council for approval. The funding that we received through the CARES Act must be allocated and spent by December 31st of 2020. More information about how these funds will be expended will be shared with the community during next week's update. A couple of announcements from the tribal programs. First is that Spring Community Cleanup is tentatively scheduled for May 19th through the 21st. The annual cleanup event will be conducted differently this year due to COVID-19. The tribe will have workers picking up items at curbside starting Tuesday, May 19th and ending Thursday, May 21st. The tribe cannot accept any hazardous household waste products, which include paint, pesticides, herbicides, oil, cleaning chemicals, antifreeze, fluorescent bulbs, or car batteries. Please be aware that as the COVID-19 situation develops, that the dates of this cleanup may be subject to change, but as of right now, they're tentatively scheduled for the 19th through the 21st. Finally, we have an announcement from the tribal court. Due to the efforts to help enforce the COVID-19 temporary curfew order as directed by the Tribal Council, the Winnebago Tribal Court is coordinating with the Winnebago Police Department to start arraigning individuals who have received curfew citations. The court is planning to start conducting hearings beginning Thursday, May 14th. And with that, I would like to thank you all for joining us today. And on behalf of the Winnebago tribe, we would like to wish everybody a safe and happy Mother's Day weekend. And that's it.
Thank you, Esther. We appreciate the update. And also keep in mind, if for more information, make sure you check out the like Esther said, the WinnebagoTribe.com. At this time, we're going to turn our attention to Dan Farringer, the Superintendent of Winnebago Public Schools. Dan.
Good afternoon, everyone. As we go through this, I want to first congratulate the seniors who should have had their ceremony this Saturday, May 9th. What we are doing is the ceremony is August 1st, but we are having a virtual show that will come out on May 9th. Also, if you get on our website, you'll be able to see the seniors and their senior spotlights. I believe there's about 22 of them on there at this time. They're pretty neat to see as they're getting the information to us and we're putting it on. I also want to thank Mrs. Tremaine and Mr. James. If you go through the community, you'll see yard signs honoring the seniors. We've heard positive things on that, but Mrs. Tremaine and Mr. James went out yesterday, I believe, and put them in the yard signs, along with Trayvon helped that. Again, the governor has mandated school closure for all activities through May 31st. The NSAA, which is the Schools Activities Association, should be releasing information on May 15th regarding the summer activities, which includes school workouts and summer camps. The track and our athletic complex remain closed. Also, Sam Fisher from Fisher Tracks should be up here next week to put the blue coating on the track. So there'll be some work going on down there. It's really important we stay off the track while he's doing that, so we have a state-of-the-art track when they're done. As you can see, the building construction is going on. They really moved. A lot of the cement work is done. The playground equipment is supposed to be here in the next week or so. That'll be put in, and then toward the end of the summer, the turf, or toward the end of the month, the turf will be in, so it will be done. It's going to be very important that they stay off that, so they'll be to avoid the spread of the COVID as that project gets finished. The food service staff, I want to thank all those that have been part of that. The kitchen staff, the delivery, they're continue to work hard. Tomorrow's delivery will be for next week's meals. The final delivery will be May 15th for the week of May 18th. There'll be 1 week where there'll be no delivery, and the summer feeding program, Kids Cafe, will start June 1st. Contact Mary Kelsey with questions regarding the summer feeding program. It'll be similar to what we've done in the past. We always had the last week of school, and then there was always a week in there, and then the summer feeding program starts. I'm not sure how it's all set up, so that's again a Mary Kelsey question. I know Pearl LaPointe has been working with Mary to make sure this is a smooth transition. I believe that's pretty much it. We'll continue to work and find out as we find out more information on how we can approach summer school. We'll bring that to the forefront in the future. Thank you again and stay safe.
Thank you, Mr. Farringer. And we also want to send our congratulations to the class of 2020. We will be planning on behalf of the Winnebago Indian News, planning on doing a special run for them and putting their senior pictures in there as well. So at this time, we're going to turn our attention to Little Priest Tribal College. The president, Manoj, the floor is yours.
Thank you, Garen. Can you guys hear me?
Yep.
Good afternoon, everybody. Before I go through my update, I just want to give a huge shout out to all the nurses. Happy Nurses Week. I'm going to slide in the doctors as well there for all your efforts during this pandemic. We have all seen their contribution to the community, not only at the reservation, but throughout the world. So kudos, thank you, truly grateful, and we know how much you have sacrificed. So thank you so much. Also want to take this opportunity to congratulate Little Priest Tribal College graduates and Winnebago Public School students on their graduation. Um, uh, Me and Dan can understand how much our students are missing this in the commencement, but we will make sure that appropriate ceremonies will be timely conducted. Again, congratulations to the Winnebago Public School graduates and Little Priest. I also want to take this opportunity to give a shout out to all the teachers who have gone far and beyond to adapt to online instruction in a very short amount of time and to seamlessly deliver the instruction. So again, thank you so much, faculty and teachers. With that, I want to kind of go through our list here. The main thing is summer registration is open. Again, I want to reinforce that the summer classes are free at Little Priest Tribal College. No tuition, no fees for all classes they enroll. The students are only responsible for textbooks and access codes. This is a great opportunity for students or any professional who wants to improve on their skills. We are also very happy to report that Little Priest Tribal College has been awarded 100 tablets from American Indian College Fund. And we will be, as soon as we receive, we will be distributing it to our students who enrolled in summer semester. This is a great gift for our community. Spring 2020 final grades are submitted. Little Priest Tribal College is creating a task force when and how to reopen this fall semester. We are taking all the precautionary measures, and based on the information we get from the Public Health, Department of Ed, information will be shared to the community of how and when it will be reopened. Very happy to share that the Winnebago Community Health System and Little Priest Tribal College have finalized the agreement for housing. So we are here for the community. We want to serve the community, and it is a great move on our side. Little Priest Tribal College is conducting community Zoom sessions. Yesterday, we conducted our first one on financial aid and admissions. We will be conducting on Wednesdays, 12 to 1 p.m. on financial aid and admissions so that students know how to register for the classes, how to get their financial aid papers done. So if you need any additional information, please call 402-878-2380, or you can email at admissions@littlepriest.edu. Summer semester starts on May 26th. It's completely online. And again, it's free to the students. LPTC is working on a MOA with Morningstar Counseling, pending board's approval on telehealth services to their students and staff and faculty. On a side note, couple of side notes, all our faculty are going to get training for online instructions in the second week of May. And I also was approached by Pastor Ricky to share his phone number to the community for any spiritual needs anybody may have. His number to contact is 402-878-2522 or 402-878-2450. Again, I want to thank the Tribal Council for their leadership and guidance. Special shout out to Pandemic Task Force and other subcommittees for all they're doing on top of their normal jobs. I'm grateful to be a part of this community. Thank you very much.
Thank you, President. Appreciate it. As now we're going to turn our attention to Mayan Beltran, Winnebago Casino Resort General Manager. Mayan.
Good afternoon. Can you hear me?
Yes.
Yeah. Okay. Good afternoon from Winnebago Casino Resort. We are very excited to try to get open as soon as possible. However, we have to follow all the guidelines that are set forth by the National Indian Gaming Commission, try to follow CDC guidelines, and from the state of Iowa. Governor Reynolds yesterday extended the disaster timeframe until May 27th at 11:59 p.m. So we are going to have some recommendations for the tribal council. And as some people already know, there are some casinos around the country, tribal casinos that have opened. Obviously, their states are different than Iowa. Woodbury County is one of 22 counties that have been extended and their closures of businesses, 10 people or more, all the different things that are going on with this pandemic because of the rise in cases, confirmed cases, positive. Right now, as of May 7th in Woodbury, they confirmed 1,429 cases. That's 106 more than yesterday with 4 deaths. So, we are taking every precaution at Winnebago Casino Resort. We want to ensure that we have no confirmed cases at Winnebago Casino Resort. So I once again want to thank all our team, the frontline people that are still there, securing our property, the safety of our property and each other. So thank you guys for that. And additionally, the ones that are over helping the security guards and the security supervisors in Winnebago with their duties. So we are looking at recommendations. We're working on guidelines. So when we do have the opportunity to reopen to our guests, we want to ensure the safety to our team members and our guests by following all 6-foot guidelines, restaurant guidelines, hospitality. So we have 16,000 masks that'll be here by May 15th. We already have some here, some on the way. We have gloves, we have disinfectants, we have plexiglass, so that we'll have shields up, glass shields up in front of our cashiers and some of the other areas throughout the casino. And again, I think one of the great things about what we did with our HVAC system update and upgrade about a year ago is that it has the state-of-the-art air filtration system that is state-of-the-art in the whole industry and for that matter, HVAC systems. But in the casino industry, it's one of the best that you can get. And that is, it takes out bacteria, germs, allergens. I mean, it really does a great job filtering out the air in our casino, and that's in our bingo hall too. So we'll make every effort that we can to open as soon as possible and ensure the safety of everyone. So we'll have some recommendations, and we'll also be following what Iowa is doing, and as well as the positive cases that are going on in our area. That's all I have for today. Thank you.
Thank you, Mayan. Appreciate it. Now we're going to turn our attention to Ho Chunk Inc., the communications manager, Sam Bursch. Sam, the floor is yours.
Thank you, Garen, and good afternoon, everyone. I'd like to start with an update on our convenience stores. The Pony Express Atacad location has reopened, and all locations continue the enhanced safety measures for customers and employees. This includes continuous cleanings during business hours and deep cleanings in the evenings. Because of national issues with the meat supply chain, we are limiting meat purchase quantities like many retailers. We'd also like to take this opportunity to remind the community scammers are using the crisis as an opportunity. Local organizations, including us, have received emails intended to compromise security. Please know the common online scams in order to protect yourself. We've posted a link to information on the Facebook page for Ho Chunk Inc. Community Impact and Engagement, so please visit that page. We've also shared some positive news stories and photos on the Ho Chunk Inc. Facebook page. If you'd like to learn more about the recent cattle purchase, raised bed and community garden projects, and Ho Chunk Farms spring planting progress, just visit the Ho Chunk Inc. page. Those are today's updates. I appreciate your time, and I'll turn it over to Brian Mathers.
Thanks, Sam. This is Brian Mathers. I'm with Ho Chunk Community Development Corporation. I'll be quick today. Our offices are still closed, but we still have staff down there every day. So if you have questions or need to get in contact with someone, you can still call down there. We're just not physically open in the office for visitors or programming right now. We continue to just basically coordinate applications and opportunities associated with the community's response to the pandemic through preparing grant proposals and looking at new funding that's available. In addition to the CARES Act, there's lots of federal and state grant opportunities that are coming through. So we're screening those, looking for those, forwarding those, or partnering with community partners to put together project ideas that might complement the priorities list that the Tribal Council and the Pandemic Task Force Committee are working on. Because in addition to the CARES Act ones, there's specific opportunities that are coming available from HUD and Commerce and USDA and Treasury, as well as foundations and things like that. So we're coordinating proposals and some programming around housing options for isolation and quarantine, things like rent assistance, food security, increasing internet connectivity in the community. So we'll be, reaching out, forming partnerships, assisting in that process as needed throughout this time. One thing I did want to mention to the broader community was, if you feel like your credit rating is being compromised, or is, you have concerns about that because of interruptions in your income or other things that are happening as a result of the pandemic, you can give us a call about that. We can do a credit check and you can see if there's been any recent dings on your credit or if that's being impacted at all. And you could also, work with Tony to think about ways to protect your credit during this time if you do have an interruption in income or some additional expenses or things that might be impacting your credit if you're unable to keep up with some of the payments or things like that. So give us a call. That might be something we could help with that would alleviate some of the stress of everything that's going on. So in closing, I just also want to thank our healthcare professionals in the community. You guys are doing a great job with this. It's really a lot to take on, and you guys are doing an awesome job of keeping people safe and protected and minimizing the potential damage here. And I wanted to echo what Danelle also said about the tremendous partnering that's happening in the community across all sectors. It's really an excellent model, I think, of how a community can respond to this type of thing in a way that meets the immediate needs, but then also positions the community to be even stronger as we emerge from this temporary, difficulty. So keep up the good work, and let us know if there's a way that we can be helpful to any of you. Thanks.
Thank you, Brian. Good information. Now we'd like to turn our attention to the Vice Chairman of the Winnebago Tribal Council, as well as the Chairman of the Winnebago Pandemic Task Force, Mr. John Snowball. John, the floor is yours.
Thank you, Garen. This week, I wanted to start off by thanking you specifically, Garen, for all that you have done and ensuring that we're connecting and we're communicating. And you do a lot, and I don't think we would be this far if it wasn't for those things that you have done. And continue those thank yous. I want to do right now is thank everyone who has played a part in what we have accomplished and what we are going to accomplish for the Winnebago people. I understand. I know that you have sacrificed your peace, sacrificed your time, maybe even sacrificed your family time. And I want to thank you, and thank you for those sacrifices and those sacrifices that you're going to continue to make in the future. And that to understand that we're doing this and we have these resources because we have a people and because those people have needs, and that we want to ensure the safety, and their health, the good health, long life, the way we always pray as a people. That's the core, that's the core of what I want to do, what I want to accomplish, and what drives me is the good health and long life for our people, for each one of us, from our children to our elders to our parents, and the way we're connected, and the way the Creator has connected it for us, that's how far I think, and that's what's at my core, in my mind and my heart. And I want to thank everyone for coming together and making it possible for us to achieve these short-term precautions that we have made, and the long-term ones, and how we're going to be stronger after this. And the pandemic task force has had their weekly meetings, and we're the finalization of the budgets of how we're going to utilize this money and ensure that it reaches the people and what it's meant for. You know, we have a people and they have needs, and that we're going to be better as a community moving forward. We're going to be stronger. You know, our weaknesses are going to be our strengths. So we have recommendations coming forward, and we've done some good things. You know, I said when the virus reached our community, my dad called me and he said, "What now?" And I said, I said, I feel good. You know, I think that we did everything we could, and we had those conversations, and we had our best people, and we put things in place. You know, and even ahead of other places, we try to be that way and think ahead. And so I felt really good, and I still feel really good about everything that we've done, and all of our people. You know, all of our best people in the key areas and how they're performing. You know, I'm really impressed, and I'm really proud to be a member of these people. You know, I'm a Winnebago tribal member. You know, that's how I feel. I feel real strong, and you know, even stronger. And you know, that we're going to continue. We're going to keep going as long as we have to keep going. And so we've been making those measures by resolution. You know, one at a time, and trying to do it fast. But we're developing a code to put it into law to have that ability for our people to pull on it when we need to, and to learn from this and to get stronger from this. So that's going to be the next recommendation from the task force to the tribal council to have our legal work on this code that will be there, that'll always be there for our people so that we learn, so we don't forget, you know, the way we always have been, how we get stronger, you know, with adversity and with things like this. We've always gotten stronger, and it's no coincidence that we're here. You know, that there's no coincidence that we live here. You know, a place that has strong medicine for our people, this land, and we're gonna do well, like the way we've always done. So I want to say those many things, and try to provide a little word of encouragement for anybody that needs it, and that I'm ready, you know, and I'm going to continue on as long as we have to. And I could see that we have a good team, and that we're going to take care of each other. And you know, I'll say about those many things, Garen. And again, thank you, Garen, for all that you have done.
Oh, thank you very much, John, for the update, and we appreciate it. And don't forget, for those viewers, that we will be doing a question and answer session with tribal officials. And now we'd like to direct our attention to Emily, who will take us into the health official questions and answer session. Emily.
Thank you, Garen. I want to remind everybody that you can submit your questions using the chat feature on Facebook or on YouTube, and also email your questions at covid@winnebagotribe.com, and we will do our best to answer them. And thank you, everybody who already submitted your questions. I will kick it off with the first question. Do we have a plan for contact tracers? Why are they so important during this time? Angie from the health department, can you answer that question?
Yeah, so contact tracers are actually where the PHNs are actually acting as the contact tracers right now. So how that works is anytime that there is a positive case that is found or determined to be within the Winnebago community, one of the PHNs will reach out to that person and will and do an investigation that consists of determining when they first developed symptoms and going back to a determined amount of time to figure out who they've been in contact with, and then also to figure out if there's any place that they had gone, or to try to determine where they were exposed to the infection. That will give us kind of more guidance and more information as to if there's other people that could possibly be exposed, and trying to be more proactive. The importance behind that is the fact that we are trying to be proactive. So we just don't want someone to be infected and then to go out into the community and expose other individuals. So if we do the contact tracing, then we can quarantine those individuals that they were in close contact and hopefully limit that exposure that goes out into the community.
Thank you. Next question, will Winnebago be the next Dakota City and explode with COVID-19 cases? I'm going to direct that towards the health department. So Mona and Angie, do you want to answer that question?
Sure. I think we always have to be mindful of what's going on around us. I think we've been very proactive, as Angie has described, with the contact tracing. We've tried to quarantine anybody that has come in contact with a positive case, whether that was in Winnebago or in our surrounding areas. We've tried to isolate people as much as we can. All of the proactive measures that John has described and others over the past few months, such as the mask law, the curfew, the social distancing, isolation, and all of that is really being proactive in trying to not be the next Dakota City or Woodbury County.
And then I just want to touch on one thing too. Part of the reason why I believe that Dakota County has kind of exploded the way it did is because they do have a meatpacking facility there that was not able to abide by social distancing due to their environment. So that just shows the importance of social distancing and taking those measures and actually making yourself personally responsible for following them to help prevent any exposures and to limit the spread here within the community.
Very informative, thank you. Next question, I'm gonna actually direct this to Danelle and then Laura, if you wanna chime in too. The question is, what is the threshold of coronavirus cases in Winnebago before we get overwhelmed? Do we have a plan to house all the cases?
Thank you. So we have been, actively monitoring the situation around us and of course in Winnebago. And as far as housing, if an individual is tested positive for COVID and, their symptoms don't meet the criteria where they would actually need to be hospitalized, the first recommendation is that they would isolate at home and do self-isolation. And the public health department, I think, has done a really good job of clarifying that and providing those instructions and guidelines and support for anybody who might be in those circumstances. And we understand, of course, that not everybody, everybody's personal situation is different. And there might be a situation where somebody's not really able to effectively isolate at home. And we've been, reading what's been happening in other places throughout the country and throughout the world. And if somebody is not able to effectively isolate at home, there is a very high risk that they could transmit it to other people that live in their household. So we've identified that as an issue. We have a group of people who have met to work on that. And we've been looking at various options where we might be able to provide housing for somebody who is in that situation. It's not yet available, but we hope to be able to launch that very soon. And it would probably end up being different housing options depending on a person's circumstances. For example, an elder or a single person, that type of thing. So we are working on that. As far as the hospital is concerned, Laura can touch on this a little bit more, but we are also monitoring the bed availability in the hospitals where we transfer patients to if somebody does need to be hospitalized. Most of our patients go to the Sioux City area at Unity Point and Mercy One. And so we're monitoring that. Laura's been in communication with folks from there and as well as to Omaha if the hospitals in Sioux City do become full. Oh,
Yeah, I mean, Danelle.
I was just going to say in short, right now they're really, the hospitals in our area are not overwhelmed and there is a good amount of bed space available. So I think that our circumstances is still good.
Right, I think the entire state, and there'll be new statistics that'll come out tomorrow, but right now for the entire state of Nebraska, as of the Wednesday, there was 77% ventilator capacity in the state and 48% bed capacity in the state. So that's looking pretty good for the state of Nebraska. In Sioux City, they do have more cases and it's ramping up over there. So we just watch it very closely.
Great, thank you both. The next question is about the coronavirus case count in Winnebago specifically. It's a little long, but the question is, what is the actual count of coronavirus cases in Winnebago? Do we count tribal members or just people that have mailboxes in Winnebago? They want to know what the criteria to be counted is. I think it is important we know that number because there could be a lot of people walking around with it. Sorry for so many questions, but I'm concerned that some community members are testing in Dakota City and live in Winnebago. So what is the true number? Mona and Angie, since we did have a PowerPoint slide with numbers, I'm going to direct that to you.
So currently there are 4 cases in Winnebago, positive cases. So what we do is that they must have a physical address in Winnebago, and then they're counted as a positive. We do get people that are self-reporting, and we follow up right away to get their test results back from the different entities, such as Dakota County, in order to find out whether they tested positive or not. Regardless, I guess we are under the assumption that most people won't be wanting to be in quarantine. And so we do isolate them right away while we're waiting for that results to be sent to us.
And then just one more thing to touch on is all these results are actually reported to the state too. So the local health departments do notify us if somebody is tested outside of Winnebago, does notify us that somebody was tested and they're positive or negative. So then we can help track those cases as well.
Thank you. And somebody asked the 4 cases, the positive in Winnebago, were they tested at 12 clams?
There's kind of, oh, go ahead, Mona.
Go ahead, Angie.
I was gonna say there's only so much information we can give out, but yes, some were tested here, but some were tested at other facilities as well.
Okay, thank you. Next question, does the virus spread by air conditioners?
And then I can take that one. So the virus is actually not airborne. It's not considered an airborne virus. So it's not sitting in the air at all times. It is a droplet form virus. So with that, it comes out in droplets and those droplets sit on surfaces. So in kind of the ideal of it is it cannot spread through the air systems. But with that, you do want to keep in mind that you want to be in well ventilated areas as it is. One, because there's there can be other bacterias or germs or allergens or something in the air that can cause irritation as well. So you always want to try to keep your filters and your air conditioning clean and changed out. If you are in a bathroom and you want to make sure it's well ventilation, you want to make sure that exhaust fan is on if one is available to turn it on, and to keep it running for a period of time to help get some of the air exchange there in the room. And then if it's a nice day to open up the windows, it's always good to get some outside air in. It's kind of more of just not having stale air, but keeping air circulating as well.
Thank you. Next question, I'm going to direct towards Danelle. I want to volunteer, but don't feel safe doing so. What can we do to help during this time? And can you get protective gear?
Thank you. One of the opportunities for volunteers right now that has been advertised in the community is for people to make masks, the cloth masks. So if you have those skills to be able to sew, we'd encourage people to participate in that by making masks. And the CHR program is collecting those and accepting donations, and then they in turn are delivering those out to community members who might need a mask when they go out to do their essential shopping or out into the public areas. So that is one opportunity to do that. And of course, you would not, need protective equipment in order to sew, since you would be doing that in your own home. There has been some discussion in the pandemic task force about how we might be able to accept volunteers or offer opportunities for community members to help. And so there have not been really any formalized arrangements for those things like that, but we will get information out if that does become available. And I think it's really wonderful. A lot of times people do want to help and contribute in whatever way that they can during times like this. So we want to make that available, but of course, at the same time, keep people safe. When and if the tribe does make those opportunities available, whatever that situation might be, we would, of course, provide whatever PPE or safety protocols that might need to be in place in order to make it a safe environment for the volunteers and everybody that's helping.
Thank you, Danelle, for that answer. Next question, are the Winnebago tribe health people and the Omaha tribe health people working together? If so, on what? If not, why not? We are all in this together. So I'm going to direct that question to Laura and Danelle. I don't know who wants to chime in first, but.
I can start, I guess. So we do have a weekly conference call with Carl T. Curtis. And so Laura has been really helping to make sure that we have that coordinated every week and has been available to communicate with the Carl T. Curtis staff, even on a case-by-case basis if there's any coordination that we need to do. As we're all aware, our communities are very close together, both in proximity, but also in relationships. So there's a lot of, kind of crossover sometimes between the communities, and a lot of the Omaha tribal members do come to 12 Plans Unity Hospital to receive care. And so I agree that that is very important that we coordinate and communicate and work together. And so we have been having weekly calls with their leadership at Carl T. Curtis to coordinate and talk about any issues that we need to address together.
I think some of the projects we've been working on, when patients go home, if they're going to need oxygen, we sat down together to decide how that looks for each of our facilities, and that worked out really well for us. And then we're working on doing some training with EMS or some mock drills with their EMS. We have done them with our EMS, so we'd like to bring their EMS. And so just when things come up, we work on projects together.
Awesome, thank you. The next question, can the hospital require employees to stay at the hospital once they come into the building? I see a lot of them leave for lunch. Is it possible to feed them lunch in the hospital? They heard that viruses spread through the bottom of shoes. So they were worried about employees leaving the hospital and taking it home to their family. What should I do until this dies down in Dakota City and Sioux City? Laura, do you want to take that question?
Yeah, our goal right now is to limit the amount of employees we have coming in and out of the hospital in general. And we really have decreased that number. A lot of people are teleworking at home, or they're taking different shifts. Currently we're not providing lunches here for the employees just because we're trying to decrease the number of dietary staff. We don't have a lot of dietary staff to begin with. And so we're just trying to make sure they stay well too. And we do encourage the staff when they go home that they take their shoes off outside or in the garage so that they're not bringing that into the house. There aren't a lot of studies or things out on the CDC website that say there's transmission per shoes. And I think you're okay and our staff is good if they go home, they take their shoes off outside and they're not bringing it in.
Emily, can I add to that?
Yeah, go ahead.
With regard to the staff risk of taking the virus home to their families, Manoj mentioned earlier that we are also working or have worked on a partnership between the college and WCHS in order to provide housing for any clinical staff who have direct patient interaction. If there's a concern about, potential exposure and going back and forth to their home and back to work, we have that opportunity for housing here locally in the community through Little Priest Tribal College and the dorm.
Wonderful. Thank you, Danelle. Next question. If I go under quarantine, what are my options? How will I get fed and how will I get my medication? Mona, can you take that one?
So each person that we are putting into quarantine or the household, the PHNs are working directly with them and contacting them either daily or twice a day, depending on their status. So if there is a need or a concern that is brought up, then that is addressed. So if they do need their meds, then the PHNs will make sure that they get them. Cindy also stated from the medical services program, if you are needing some supplies or an issue with being fed, to please call if you don't feel comfortable discussing it with the PHN, to call her at 402-878-2277, and the CHRs will be able to help you as well.
Thank you, Mona. Next question. How often do hospital employees get tested? Laura, can you answer that one?
Yeah. We don't test employees just across the board. We have criteria that we follow. We have a team that works together. And when employees have symptoms or they've been exposed to somebody that's positive, we sit down and we go through kind of an algorithm. We talk about who should be tested, and we follow the CDC guidelines and even help with from the PHNs on who, if they have somebody that they're contact tracing. We work together. Employee health nurse works with them to see who should be tested. Many times we'll test an employee before they come back to work, so that we know what's going on before they come back to work. So there's not a blanket that we test everybody across the board.
Okay, great. And the very last question we have for today for the medical and public health staff is for Laura. Do you provide drive-through testing at the hospital?
So we are providing some drive-through testing, but this is only for patients that have physician's orders. And it's the same up at the Siouxland Community Health Center. You can only go through there and get tested if you have orders or you meet the criteria. They're not just testing people that want to drive through and get a test. And so we have, in order to limit the exposure to our staff and for the convenience of our patients, we have done some drive up or outside testing, and it's worked fairly well. But again, it's not just for somebody to come and drive up. You need an appointment and you need a doctor's order, and your doctor will talk to you to see if that's even something that is feasible for you.
Great, thank you all so much. So that concludes this week's portion of the healthcare Q&A. I want to mention again, you can submit your questions on the chat feature or email covid@winnebagotribe.com, and we will ask those questions in next week's live stream. Thank you to Danelle, Mona, Angie, and Laura for answering all of those community member questions. Right now, I'm going to throw it to Garen for the tribal questions.
Thank you, Emily, and thank you for those responses. Definitely Angie, Mona, and Danelle, everybody. At this time, we're going to go into some of the questions that relate to the tribe and the tribal council. So we're going to go over to Coley Brown, chairman of the Winnebago tribe. Coley, are you there?
Yes.
Okay, and then also John Snowball, the chairman of the Winnebago Pandemic Task Force. Here's the first question that came through. On Tuesday, it was Missing Murdered Indigenous Women Awareness Day. What did the Winnebago tribe to do to raise awareness about this issue? Even though we are in a pandemic, man camps are being built in Nebraska, the pipeline still being built in Nebraska. What is the tribe's stance on this pipeline? When Frank White was chair, he made it clear that he was against the pipeline. Has the council's stance changed?
Want to say something about that or no? This is Coley. I have Eric Armand with me too. And I know this year we had a couple conversations with the senators and the Attorney General, and we brought up something about it. You know, we I don't know if it ever got out there, but it was brought to my attention. You know, these women are missing, and somebody said, what if them women are in those pipeline trenches? And we don't know. We brought that up to them. I don't know how far that went, but we voiced that to the senators and attorney general. You know, what if there's one woman that's missing, and she's in one of those trenches? Other than that, not out of this week, we haven't done anything. But maybe Eric wants to speak on that, if he would like to.
I know that last year, or I think it was 2 years ago, when the KXL was going through, the United Tribes of Nebraska passed a resolution to the state Congress and opposing the KXL pipeline. And so this just started coming within this last week. It entered into Nebraska. And I would like to make a suggestion to the tribal council that we do that again for the KXL, to make a resolution and send that up to the state in opposition to the pipeline coming into Nebraska now. And yeah, so I'd say about that much on that, on my stance for that, for the future of what we should do as the United Tribes of Nebraska. Thank you.
Thank you, Councilman Armel. The next question here is it's kind of interesting that, but I'll just ask it. How come the CEO of HCI and the CEO of the hospital are not on these live streams? You have everyone else on them. I don't know if John, maybe you want to address that, or I see that Danelle's on this one, so it's good to see Danelle on this one, but there's a question for Coley or John.
I guess I could say that HCI does have representation on this live stream with their communications person, and the 12 plans has had strong representation on here, and today Danelle was on, and so we're open to suggestions and on how we can be better, more communicate to our people. So thank you for that question. And then even going back to the previous question, I think it points out something important as well with them murdered, missing Indigenous women and the pipeline and other things like our battles with them. We're still fighting many battles, many fronts, and we can't forget that. We can't forget that during this pandemic that we're being attacked on all sides, and we need to continue. So I want to thank whoever asked that question. It was a good question. It helps us open our eyes again. And we have to keep doing that. We have to keep opening our eyes again, and remember, and keep going. And keep fighting in all those areas, on all fronts. Thank you.
Thank you. The next question. I have family members that all they want to do is provide for the family. They work at Tyson, and I don't want them to go back to work. They were called back to work yesterday. Can the tribe do anything to give them opportunities instead of going back? Offer them a job at the same pay?
So I could talk. There's going to be new jobs, new opportunities with this CARES Act money coming, and the tribal council finalizing the budget and that process, and that there's going to be new positions, and I had this thought myself, and again, this is a really good question. That's smart. It would be smart to prioritize, to identify those community members that are working up there and say that we have new positions and that we want you to work in our community and keep you safe for yourself and for your family and for our community. And I think it's good, and I would like to see that, that we prioritize those people, if they're willing, it's their choice, but make that an option, that we can keep them safe, keep all of our community members safe with these new positions that are coming, and that the tribe is going to have the tribal council is going to have a really healthy recommendations. A lot of everything's going to be on the table for the council to consider, and developing that final budget on how we can help our people with these funds. So I think it's really important, and that's a good question, and that's one of my wants as well, to provide that to those workers up there, that we want to make a job here for you, then that you can do good work here, and it's more safe for you and it's more safe for us. Thank you.
Thank you. Next question. And this one is for Esther, the CEO of the Winnebago tribe. Do you know if the tribe is still going to do clothing allowance this year? Since we are in a pandemic, will it be sent? Maybe instead of clothing allowance for the kids, we can do a food allowance for the kids, especially for the summer when the school isn't going to be feeding the kids.
Okay, there are several different parts to this question, so I'll respond regarding the clothing allowance. And yes, we are still planning on doing a clothing allowance disbursement later on this summer. Unfortunately, that's about as much information as I have at this point on that. We don't have the details yet worked out as to how we're going to do the disbursement. So as we get closer to that date, more information will be forthcoming to the tribal membership about how we're going to get that accomplished and what the process will be. The second part of the question, to me, that is referring to summer feeding. And so I'm going to ask for Mona Zafante or somebody from public health if they could discuss what the procedures for summer feeding is going to be this year.
Thank you, Esther. So we're looking at our Kids Cafe. Mary Kelsey is now in the process of hiring some staff, and we'll probably be looking at it to be similar to what we're doing for the senior center, where we'll be having delivery or curbside pickup, and as well as providing some nutritional lessons, things that they would have been able to get at the center. And of course, we'll be reevaluating this as the time progresses and depending on what the situation looks like here in the community. So stay tuned. We'll have more information out very quickly because it'll start on June 1st.
Thank you for that response. Next question here for the council. Dakota City is the nation's third highest COVID hotspot per capita. I think it's time to close the borders now. What is the council waiting for?
So I'm as the chairman of the COVID pandemic preparedness task force, I'm also the lead on the security subcommittee, and so we developed, me and the chief of police and a few others in mine, we've developed a budget to move forward and do whatever we have to do. So we have a workforce and abilities to make things happen, and so it's a very good budget that we have. We're gonna and the council is gonna consider that, and if some of those things get approved and we move forward, we're gonna have those abilities. And but looking at the national hotspot up there and us down here, I think we're doing well. And we're guarding the river area down here, and we're guarding our town, and our town's is really special. Our village, the Winnebago people, it's really special. It's different. It's different than any other place, and it's because we protect each other. You know, when there's a car around town that nobody knows. The the information is passed along fast. We protect each other, and so and so I think that's important to call upon at this time, that we do look out for each other, and that's going to be more powerful than anything. I think that's going to be more powerful than closing any roads. And so I think we're that much farther along as a community. We really love each other, and we have families, and they're really respectful to families, and that we want good for all of us. And that's really special as a community. And I think that's going to go a long way with protecting each other and keeping our village safe. That we're all going to play a part in that, and that we care so much. We care so much that we have people that ask these questions. We have people that worry about it, and me too. I worry about it, but I think we're doing good. And if time comes, we're going to take them actions when it's time to take them actions. Thank you.
Chairman, would you like to add to that, or?
The only thing I can try and make sense to us not closing down is I had questions, and the way I look at the meat packing plant, Dakota City and Sioux Falls, and how those outbreaks happen, there's things to consider with those. But you have to wonder, you have to ask yourself, why aren't these hospitals having outbreaks? And there's things you can think about, and there's explanations why. Our hospital hasn't broke out. Sioux City, you don't hear that hospitals aren't breaking out much, but they are. But we will try and stay safe, and if that comes, yes, we will address that, and then we will try and put up some kind of roadblocks eventually if we feel we have to. That's all.
Thank you, Chairman. This last one came in last week here. It's regarding the CARES Act that is required that the tribal governments, they must submit completed payment materials no later than 11:59 p.m. on April 17, 2020. Have we, the tribe, met that deadline to ensure that we receive payments? And if so, when can we expect those payments? These payments will likely ensure people keep their jobs. I think Esther had mentioned something that in her report. I don't know if Chairman Brown or Vice Chairman Snowball would like to also elaborate on that question.
Yeah, sure. So one of the subcommittees for the task force is the federal funding, state funding, and we have our best people with connections at the Capitol and connections in Washington D.C. and we're being ahead of it, and we're getting the latest news, and we're sharing the news with all the entities and the tribes. So we're on top of that, and that deadline was met, and those funds were received to date, and so they're finalizing the budgets, and we're going through that process that we plan to do, a long time ago when we first learned of this CARES Act. So a lot of planning has been done, and like I said, I always want to thank everyone for everything that they have accomplished for us. It's going to go a long way for our people.
So I want to add to that part of our team will be discussing that tomorrow, and they're going to bring that to tribal council maybe Wednesday. And as soon as tribal council makes a decision on those funds, the community will know. We will have a report, and we will send that out and make sure it's out so our community knows what's going on and how it's going. Is that the last question?
Correct. That is the last question, Chairman.
Okay, I had something for the health department that I just wanted to mention and put a bug in their ear. Our children have been locked up practically for about a month and a half now, and they've been well taken care of with the school, sending them food. And my concern is their health. I know some families, some children, they have not left their yard, and some yards are small. So consider that, and the task force consider that with this money we have. And if it's for prevention, and to consider our children with diabetes, prevention and something like that, okay? Put that into your thoughts and think of our children and how much longer this will go on. Thank you.
Thank you, Chairman Brown. And we want to thank all our participants, those viewers out there. Make sure that you folks stay safe. And we will be broadcasting next Thursday. And we'd like to thank Danelle Smith, Laura Gamble, Sam Burris from HCI, Winnebago Public School, Superintendent Dan Farringer, John Snowball, Emily. And we kind of want to send a kind of a prayers to Emily. She's going to be going, and next week she'll be out of the live stream. So we're going to ask Danelle to help us out next week. But we want to send our prayers to Emily for next week. Mona, we appreciate all of you do. Angie, President, Little Priest Tribal College, Manoj, and Mayan, we appreciate you, and we look forward to seeing a lot of the things that are going to come forward from Winnebago and getting back online slowly but surely. I know that our sister tribe from the south, Seven Clans Casino, the Oto, Missouri tribe, they're back online. And so we look forward to reaching out and kind of getting educated on some of the things that they're doing and implementing. Brian Mathers, we appreciate the updates, and we thank you for everything that you do for the Ho-Chunk Community Development Corporation as well as the community of Winnebago. So with that, folks, you guys have a good evening. Today is the National Day of Prayer, and so we just want to say God bless and stay safe. Have a good evening.
Thank you, Garen.
Thank you,